So I think we discussed a lot of topics today, and we highlighted a lot of important points. And I think May was also Mental Health Awareness Month.
That is correct.
Yes. So, what are your take-home messages or your final thoughts after this talk?
I think the final thought is that mental health is as important and equally important as the physical health. Just like, when we see ourselves or our loved ones going through some physical pain, who try to get help. Similarly, when we see ourselves and our loved ones going through some difficult emotional pain, I think we need to help. And I also want, our audience to be mindful. Many times it's very easy to offer help to others, and sometimes it is coming at our own cost, and we are realizing it, that we are struggling, suffering uh, because of that service, but we keep doing it. So one thing which I learned from my mentor, if I don't have $1,000, I cannot give it to the other person, So if I don't have self-respect, if I'm not happy what I'm doing, if I'm not satisfied, it's very hard to make other person happy.
Yeah.
So it's important to identify your emotions. It's important to seek for help. And the other thing is, as a parent, as a person, as a teacher, as a student, we are human being at the end. Making mistakes, it's very human and it's very normal.
Okay.
So let's say, if someone comes to you and tell you, oh, I made a mistake, and you will say, it's okay, things happen. But if I make mistake myself, I just keep going on and on. How horrible I am, how stupid I am, how silly of me. So just like we tell other to forgive, we have to help ourselves to forgive when we make mistakes. So being kind to yourself, being gentle to yourself, being forgiving to yourself, and being empathic to yourself. These are some of the ways that we can bring kindness, we can bring honor, and we can bring grace to ourselves.
Okay. Is there any websites, any books that you could recommend people could read about and know more about mental health and maybe even how to prevent it, if that's possible?
I think there are a lot of good resources. I know American Academy of Child and Adolescent Psychiatry, they have a lot of resources for parents and families. American Psychiatric Association, they have a lot of resources. I know NAMI, they have a lot of resources for the families. And there are always, you can reach out to your primary care, your pediatrician. They can connect you with those resources as well. Similarly, so especially in parenting, because that's what we talk about, there are a lot of good books. One I would suggest is Power of Showing Up by Dr. Dan Siegel. Nonviolent Communication is another good one. Unconditional Parenting. Similarly, if you want to build some healthy habits, Atomic Habits is a really good one.
It is a very nice book.
And around social media, Common Sense Media is a really good website that can help you which website at which age group your children can use. And similarly, every big hospital like a Mayo Clinic, Harvard Boston Children's Hospital, all these big hospitals on their website, they have a lot of resources as well. And and always, because nowadays somehow people go to social media to seek for help. Let's say if you are going through depression, when you are typing, in your search engine, don't just type depression. Type depression recovery, depression treatment. Because if you just type depression, all the people who ever get depressed, they will come, and those people will share horrible stories. But when you say depression recovery, depression treatment, anxiety treatment, suicidal treatment, then people who talk about recovery and likely the mental health professional videos might pop up.